Joining me now is Dr. Vim Patel. He is from Evolve Personal Health. Thank you so much for joining us today.
Thanks, Randy.
So we're going to talk about new and old, I guess the best way of looking at things. Integrative health or integrative medicine is kind of a buzzword coming in, but not really a truly new concept, something that I think that is finally coming to its own. So let's talk about integrative medicine to start with, kind of the thought patterns behind it, what majority of Americans understand, and where the rest of the world kind of comes into it.
Okay. Well, I think before we can understand what integrative medicine is, let's define what our conventional system of healthcare is here in America. Conventional or traditional medicine, also known as Western medicine, has been practiced in the developed world for the last 2 centuries. It's defined as the treatment of disease using medication or surgical intervention to eradicate that disease. An underlying assumption in this model is that you have to have disease. Stated another way, you must be sick in order to receive treatment. Integrative medicine is a combination of, we'll say, Western medicine and some Eastern philosophies. The difference in this type of medicine is it looks more at the whole person, the treatment of, it's a belief where health and wellness is a delicate balance in an individual. It's a balance of mind, body, and the spirit. The primary focus is to promote good health rather than treat disease.
And obviously the philosophy makes sense, because with preventive medicine, we can prevent things, but we have very little chances of curing most things. Once disease takes place, it takes place. So we look at not opposing thought patterns, but now we're talking about things coming together. And integration means obviously taking a little bit of both on each side. There's some pluses and minuses with every medicine. Tell about the pluses, and we'll talk about the minuses in a second.
The pluses are some of these modalities. Let's take, for instance, Chinese medicine or Ayurvedic medicine. They've been studied for centuries. They've been practiced in their countries, and some are even primary medical modalities in their country. So we have a long history of practice. We can call them anecdotal evidence. In our system of medicine, we believe in the double-blind study, where we have to have proven benefit, oftentimes cost effectiveness, in order to implement that within our medical system. Integrative practices take a combination of those practices, such as massage or yoga, that may not have efficacy studies, and incorporates them into our traditional Western care.
And obviously nowadays we're looking at the body more from all angles, and a lot of the double-blind studies have some exclusionary things. We're not really sure if they work most of the time. We're starting to challenge these data, but you're now seeing some of the other modalities being studied in the same way. Are we getting some positives out of that?
Absolutely. We've had big institutions such as Harvard, Duke, Mayo Clinic study some of these modalities, and in fact even integrate these modalities. Let's take, for instance, Reiki. Some of these practices, such as therapeutic touch, we've seen in post-op patients, they tend to reduce anxiety, increase post-op effectiveness, happiness factors. These intangible factors that we can kind of look to say, how is this patient getting better? They're actually being applied in these bigger institutions to show better efficacy on patient care.
We know that there's data and data. So we look at data and say, okay, I can reproduce this data. But people aren't data. I mean, they have numbers, they have pieces, but you know, as osteopathic physicians, alternative physicians, everything else, we know that there are different ways to get the same thing done, and patient's preference now becomes a major issue. Now with the new thing coming from the government as far as how they're going to pay us, outcomes are going to be a major piece, and that becomes something that makes the patient better. So when we look at some of the things, most of it's going to be the patients don't understand how they could do something different because they've never been exposed to it. So can you go over some of the things that people say, well, that won't work for me, or some of the common thoughts patterns of why people turn down alternative medicines and don't give it a chance?
Simply because of the fact that we haven't been exposed to some of these modalities. We do have data that does validate these treatments. Let's take, for instance, massage. We've seen that one massage a month can reduce the usage of opiates by nearly 50%. Now that's a shocking statistic. If we apply this sort of therapeutic modality, which is still considered an alternative treatment, believe it or not, in this day and age, massage, we can actually make the person as an entire entity, rather than simply seeing the pain as a medical treatment where we have to give opiates.
Sure, and there's more ways than one to fix a problem or address
Absolutely.
a problem. And I think a lot of it comes into the patient's, not just exposure, but understanding of the process and belief in the process. So certainly we know that the more you and I discuss it, and the more that we believe in it ourselves, so the patients will have better experiences with it. So I know in Tampa there's a few people that do these things, and I think probably one of the biggest pieces we look on integrative health is how do we get someone exposed to that environment. So tell me a little bit about what's going on in Tampa.
Well, Tampa is a phenomenal city right now. I don't think I can drive through Tampa without seeing a massage studio or yoga studio. We are also going to show the world what a healthy city looks like with the Channelside Well District coming up here. We have exciting new practices such as ours at Evolve Personal Health, where we take all the benefits of traditional Western medicine and we take the proven modalities and combine them in a way to make our patients live happier and healthier lives.
And when we look at health, we miss that emotional piece. A lot of times when we talk to a doctor, I'm going to give you these many treatments, we're going to do these things, and it's how it's going to work. And not take into account the patient's thought patterns, their fears, their other things, and then the ancillary problems. We have collateral damage when we do these things. Radiation causes issues, chemo causes issues. Integrative means that we're going to take care of all these issues at the same time and explain it to the patient in a different way.
We forget to see the individual as an entire entity. What we think, what we believe, how we perceive the disease coming before us, all matters in how we are going to heal. At Evolve Personal Health, we take a look at the individual from the entire aspect, from their physical capacity to their nutritional profile to their mental well-being. The totality of an individual is going to dictate how that individual progresses in the disease state.
Absolutely.
So we use techniques including all the benefits of traditional medicine and including proven effective coaching techniques to push the patient forward in their health.
And it sounds like what we should do. Obviously, we want to take care of the person in front of us, not the patient or disease that's there.
Right.
Great ideas. Thank you so much for joining us. Thank you for exposing our population to it. Thank you for working towards that to make it so that healthcare is actually healthcare and preventive.
Thank you, Randy.